Hello everyone, today I'll be talking about Creutzfeldt-Jakob disease, or CJD. I bet no one's actually heard of this disease, and heck, I didn't even hear about it until I was looking for an interesting topic to talk about, but you're probably also wondering how it pertains to you, and in reality it probably doesn't right now, but it definitely could. It's very possible that it could affect you or maybe one of your loved ones, so it's really important that we're informed about this disease. So first I'll be talking about what exactly it is, and I'll go a little bit in detail on that. Also, how it's diagnosed, the three main forms, and how it can be transmitted. So what is CJD? It is a rare and fatal degenerative disorder affecting 1 in a million people worldwide, and there are about 300 cases in the US per year. This disease was first described in the 1920s, so it is relatively new. We don't know a lot about it yet. Also, it is a prion disease. And a prion disease is a transmissible spongiform encephalopathies disease, and that's just a fancy name for a group of neurodegenerative conditions. So the first prion diseases were identified in the 1730s with the sheep that was infecting goats. And the most common form in animals is BSE, otherwise known as mad cow disease, and I'll explain why that's important a little bit later. Prion diseases are associated with the buildup of abnormally formed proteins in your brain, and these abnormally formed proteins find your normally shaped proteins, and they misshape those ones. And so this just kind of creates a vicious cycle, and that leads to the progression of the abnormally shaped proteins and the declination of your normally shaped proteins. And because prion proteins are normally broken down in your body naturally once they're finished serving their purpose, these misshapen proteins are just a huge issue because your body doesn't really know what to do with them, and so that just leads to the overaccumulation of misshapen proteins in your body. For Creutzfeldt-Jakob disease, this replication process is known as the incubation period, which can take up to 40 years. And because this takes so long, it is a very random disease. It kind of just appears out of nowhere. There's not a lot we know about it. And because the prion protein plays a role in the message transportation between neurons, it has a huge effect cognitively on the person who is infected. There are three main forms: sporadic, hereditary, and acquired, and sporadic is the most common form, which is completely random, and it accounts for at least 85% of the cases that we know about. So this appears when the patient has no known risk factors for the disease. And hereditary is for about 5 to 10%, and that's when there is a family history of the disease, or the patient tests positive for certain genetic mutations associated with dementia. Acquired is for less than 1%, and that's transmitted by exposure to infected brain tissue or spinal cord fluid. And there is no scientific proof proving that CJD is spreadable through casual contact. So if I'm infected and I were to sneeze on one of you, you wouldn't get it. It's not viral that way. You would have to come in contact with any part of my nervous system. And according to the CJD Foundation, how it's diagnosed, there is no specific diagnostic test. There's nothing like a monospot where you could prick your thumb and you get a positive and negative, or if you have that disease. So if you're suspected of this disease, your doctor has to rule out treatable forms of chronic dementia or chronic meningitis and dementia. And they do this by consultation with other physicians, an EEG or a spinal tap or MRI. EEGs can show specific abnormalities of the disease, and an MRI can help reveal certain patterns of degeneration in your brain. Confirming a diagnosis is pretty hard because you would have to do a brain biopsy or an autopsy, and obviously for an autopsy you need to be dead, so there's not a lot you can do with that. Also with the brain biopsy, you can't just take out a huge chunk of someone's brain. So you would have to pick a certain spot of the brain, and it's just incredibly unlikely that you would hit a spot that is being infected by the disease. And because it is transmitted by contact with infected brain tissue, it's not a very safe process for both patient and physician. And so scientists are working on developing a laboratory test of CJD for patients already showing chronic signs. Although it's not exactly, it's not concrete yet. I found this in a research journal, so it's still under development. But if we're able to get this down and create a test, it just makes it a lot safer for both physician and patient, and hopefully it would be able to slow down the progression of the disease. So overall, this disease is rare and fatal, but and it can affect anybody. And so it's really important that we're knowledgeable about this disease, and that we kind of get the ball rolling and getting more knowledge on it and help spread awareness. And also being knowledgeable on it could help better prepare you if anyone you know or you're close to, or even if yourself is diagnosed with the disease. So thank you.